All right, we are ready to go. Good. Welcome, everybody. Thank you so much for joining us on our monthly episode of Dinner with the Doctors. My name is Dr. John Raphael Heiz. I am a doctor of traditional Chinese medicine and holistic physician at Be Optimal. And it's great to be with you guys tonight. It's a lovely evening. It's a wonderful Tuesday. And welcome, Beverly. How are you? As everyone logs in, I will attempt to admit them. So wonderful. Yeah, welcome. It's great to be here. So just as a reminder for everyone, we meet for dinner with the docs every second Tuesday of every month with Dr. Carrie and Dr. Abby, and myself every fourth Tuesday of every month. We will host a dinner with the docs. Today, we have the wonderful topic of fasting, and yeah, we're gonna have fun. We're gonna have a blast. For those of you on Zoom and on Facebook or Instagram, if you have any questions, feel free to type them, or if you're on Zoom, feel free to ask them, or cut me off if you need to at any point, and then we'll address those. But needless to say, diving right in, fasting is a new concept that has been thrown around amidst in the last very few years. But the reality is that fasting has been around for generations, for centuries, for millennia. In fact, back in the day, um, unless you went out to hunt for your food, you didn't have food on the table. Nowadays, we actually have an abundance of food, if I dare say those words, simply because we have 15 restaurants in one block. So not only do we have choice, but which is a great thing, but we have abundance with regards to food. And why fasting is so important is what we're going to discuss here today. Also, what is fasting, and a little history of how I got into fasting and what it has done for me. And then we'll finish with a few of the, we'll call it scientific evidence, benefits that it has proven to be effective for. So that's the topic for today. All right. Needless to say, fasting is defined as abstinence of all food or some food and beverage and water for a certain amount of time. That is what the definition of fasting is. And there are many different um, methods or styles of fasting. Uh, and there's not one type of fasting that is better than the other. And we're going to dive into the different types of fasting in a little bit, and uh, what certain ones can do for you that others might not. But needless to say, when why is fasting so important is because since we have this constant abundance of food or access to food, throughout time we've lost the the understanding that we need to give our body a break. We need to give our body the opportunity to maintain itself. We have to give our body the necessary time to pause and not have to work so hard. And these days, we're constantly, eating something or nibbling on something um, because it's habitual, right? I think we could all understand that actually there's I just came across a Japanese word that means I'm not hungry, but my mouth is lonely. So it was it's funny. I came across that earlier today. There's a word for that, but it's true. We're constantly needing to I guess oral fixation or something, especially because we either use it to keep focused on a certain task that we are in a process of doing, or it gives us something to do, because more and more people are finding it easier nowadays, but being still and doing nothing um, can be quite taxing, right? So um, giving our body enough opportune time of rest with regards to what we put in it. Now, there are different styles of eating, there are different ways of eating, and in the near future, I will have our next episodes on correct ways of eating. But we're not going to dive into that too much right now. Needless to say, the only seed I'm going to plant is when you are ready to nourish your system, listen to your system, pay attention to your system, bring awareness and observe your vessel, your vehicle on this plane of existence, and ask it what it needs. Because if you ask it, it's going to let you know, I need a little bit of red meat, or I need some chicken, or I need steamed vegetables, or I need dot dot dot, the list goes on. And if you follow that mindset and actually connect with your food, you're going to have a much better um, quality of integrating the food that you eat. But on the other side of that coin, which is the topic of today, we need to give our system a break. We need to give our system a break. Our digestive system digests our food and our water, but it does so much more than that. It digests our thoughts, our emotions. It digests the state of being that we are in. And state of being has to do with our physical body, our mental body, and our emotional body. And if those three bodies are not in proper alignment, then our digestive system has to work that much harder to metabolize, to break down and metabolize the information that it is being given. So constantly eating at inopportune times and not giving your system a break, well, it's like overworking. It's like going to the gym and working out for 4 hours straight, and you wonder why you are tired or you are sore, or maybe you actually feel worse. So fasting allows us to give our digestive system a break, and in doing so, it allows for correct communication of all of our vital information. So now we're talking about, yes, it has a direct link to our digestive system, but then if we give it a break and all of our energy, all of our um, internal mechanisms, whether autonomic or not, is all in one area, then the consciousness, well, I'll call it that, the consciousness can't work at its best because it's located in one area. So if you allow resting of your digestive system, guess what? It allows for harmonization of your neurological system. It allows for correct communication within your endocrine system. So now we have correct uh, 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 transference of our hormones, right? It gives us, uh, it allows us to increase our immune system. It allows our vascular system, our heart, excuse me, to pump adequate blood, oxygenated blood throughout our vascular system. I think we spoke about this a couple episodes ago, but our vascular system is 3 times the circumference of the Earth. With our veins, our arteries, and capillaries, it's amazing the micro universe that we have within our body. We are but a micro to the macro, right? At least that's how the saying goes. So that's, without going too in depth, that's what happens when we allow our digestive system to just chillax, take it easy. We don't have to work so hard. Wow, dare I say, we're empty, and empty is can be a good thing for a period of time. So that's what fasting is. Okay. Now, fasting, again, like mentioned before, there are many types of fasting, and we're going to go into that in a second. But usually, a good amount of time that is appropriate for the best benefits of fasting is anywhere between 16 and 72 hours. Okay. We'll go why the 16 in a second, but just give me a moment to go through this real quick. The different types of fasting. There's water fasting. Water fasting means that you only drink water for a certain period of time. There's juice fasting, where you drink organic juices, for example, again, certain amount of time to allow your body to get adequate nutrients in liquid form. There's intermittent fasting. Intermittent fasting is a type of fast where you restrain yourself from eating from a period of time, but you still eat every day. And usually, with regards to intermittent fasting, the average ratio is 16 to 8 hours. So 16 hours of fasting, so not eating, only drinking water. Um, Coffee and tea is allowed, but we'll get to that in a second. And allowing for an 8 hour window for you to get your nutrients. There are variants to this. There's 14:10. There's 24. Um, 20 hours of fasting, 4 hours of your eating window, but usually the average is 16 to 8. And it's one of the easier um, types of fast to do. Everyone can do it. What I recommend most of the time, if people are interested in doing intermittent fasting, is that you start at 8 p.m. and you go until noon the next day. What that allows you is 16 hours, but in that 16 hours, you're asleep for almost half if you sleep 8 hour nights, right? So it you have that 8 hour sleeping window where you're not gonna feel too hungry, and it's one of the easier ones to do. And then you eat between the noon o'clock, the 12 o'clock to 8 p.m. There we go. We have one more participant joining us on Zoom. Diana, welcome, welcome. Wonderful. So that's intermittent fasting, and it's very powerful. Um, Throughout a longer period of time, you could really reap the benefits of intermittent fasting. There's partial fasting, and partial fasting involves certain foods and drinks that you avoid certain foods or drinks that are processed, essentially. So reducing caffeine products or animal products, um, uh, or caffeine. I think I said caffeine. Um, so it's eliminating a type of food from your daily regimen for a period of time. That's partial fasting. And then there's calorie restriction. And calorie restriction is just restricting the amount of calories that you are um, uh, giving your system for a period of time, but still allowing for intake of food and water. Okay. Um, Now, why? Well, let me go into the other various forms. There's something called OMAD, OMAD. And OMAD is a type of fasting where you only eat one meal a day. And one meal a day is more than feasible. Again, back in the day, we would go 3, 5, 7, sometimes 10 days without food because we couldn't find something to hunt. but our body is more than capable to adapt to that style um, of nourishment. So OMAD is another one. There's something called fat fast that is trending nowadays. And a fat fast is fasting by only nourishing your system, only intaking water and fats. Okay, so this common modern regimen of this is bulletproof coffee, for example, where to your coffee you add either butter, coconut oil, MCT oil. Um, I myself, when I do a bulletproof coffee, I do a tablespoon of ghee and a tablespoon of MCT. Um, but I've trained my system to get that amount of fat first thing in the morning. So be mindful, be kind to your body, and if you're interested in doing uh, a fat full breakfast, I do recommend that as one way of doing it. But fat fast has been used by many actors when they need to lose weight in a short period of time or bulk up. Um, it is not recommended to do a fat fast more than 5 days. Okay, please be mindful of that. It can be hard on the system. Okay, there's short-term fasting and then there's long-term fasting. So fasting, you, the body, the body is very good at letting you know when it is hungry versus when it is starving. Okay, so if you are in tune with your body, if you know your body's responses, if you know how to listen to your body, you can go a very long period of time uh, without having any food in your system. And I'll give you an example in a little bit. There's a common one 72-hour water fast where you only drink water for 72 hours, 3 days. Very common, again, very easy. Everyone can do it without a problem. Okay. And then the last one that I have come across and that I have also experienced is called dry fasting. Dry fasting is a type of fast that is done in a shorter period of time. You could do it anywhere between 24 and 72 hours. Again, as long as you know your body's signs. But dry fasting is abstaining from eating anything or drinking anything. So, a water fast, for example, you're drinking water throughout your fast and not eating anything, right? Through that period. Dry fasting, you do not drink, you do not eat. There are two types of dry fasting. One is called soft dry fast, and the other one is called a hard dry fast. A soft dry fast, you don't drink or eat anything for a period of time. A hard dry fast is one of the harder fasts to do, and that is abstaining of any contact with water. Okay, so no brushing your teeth, no showering, no washing your hands. And the premise behind that is that your skin pores, um, they integrate water. So a what they call a true dry fast back in the day is abstaining from any contact of water so that your body um, can metabolize all of the information that it has within, allowing for expelling of all toxic material in your cells. And then it has been shown that the um, purest water that we can find today is the water that is created by your individual cells because it is the purest water, and that is done through a dry fast. So those are the different types of fasting, and their benefits can change depending on what type of fast and for how long of a period you do it for. Now, a word that has been uh, used quite often in we'll call it the last couple of years, the last 5 years, within the last 5 years. It's a word, the word is autophagy, Autophagy, autophagy. And autophagy is a um, bodily process that was discovered whilst fasting, and it is the process where the body, excuse me, it is the body's way of cleaning out all damaged cells in for one purpose and one purpose only, to generate new cells. And through this process of autophagy, you can create stem cells. So that's of importance in the medical community now, and the communities that are doing more and more research on the effects, the biochemical effects of fasting. But essentially, autophagy is the recycling of cells. You know, cells, when cells are created, they have a programmed function. They are programmed to do something, and their last program is cellular death. It's a program called apoptosis, right? And when cells are not able or not willing to die off, or to click the OK button on the last program of apoptosis, what happens? It remains. It remains past its programmed death, and it starts collecting more and more cells to do the same thing. And that in itself is a tumor or cancer. Okay, so cellular death. I think I used the example last time we got connected. Cellular death, excuse me, a death that is not able to properly die is a cell that has insomnia. Hence why one of my main treatments when I treat my patients is knowing whether they suffer from insomnia or not. Because if you treat the the body systemically, and treat the insomnia correctly, they're if you don't treat the body correctly, I should say, they're opening the door to the possibility of cancer, very much so. Okay, but going back, autophagy is cellular recycling. That's it. It's the cleansing on a cellular level, and that is why intermittent fasting is necessary to be done within 16 hours, because in the 16-hour mark, that's when your body begins the process of autophagy. Okay, so again, can you do a 12-hour fast? Sure, you're still going to reap the benefits, but it has been calculated that in order to reach autophagy or cellular recycling, you need to have fasted for a period of 16 hours. It's the word autophagy, auto, meaning self, right? Auto, and then phagy, it means eating. So it's not the best literal translation, but it's auto eating. You are auto eating yourself. You are self eating yourself, but for the purpose of cleansing, for the purpose of creating new stem cells that can go to the various parts of your body in order to perform their task. One of the main benefits of fasting is inflammation. It has to do with inflammation. We're going to talk about that in a moment to go. But a little bit of history with how I came across fasting. I started fasting 2 years ago. I started fasting 2 years ago because one, I don't recommend, or I usually don't recommend to my patients anything I haven't done personally, because I'm old school like that. um, or at least I know somebody that has done it. So that's kind of how I do um, my treatments. So I started fasting because, funny coincidence, maybe not, I started getting YouTube feeds and then Facebook feeds and articles sent to me about fasting. What is fasting and why people are doing it, and all these different articles on fasting. I have a question from Beverly here. Um, with the intermittent fast, can you drink water in that 16-hour window? Yes, you can, for sure. So in uh, during your fast, unless you are doing a dry fast, you are allowed to drink water, coffee, and tea. Water, because you're allowing correct hydration. Coffee, because it helps with the cravings. And it also and tea, because they both have theanine in them, and theanine allows for a faster access to the process of autophagy. So those are the three main things you can intake during your water fast or intermittent fasting, okay, during that period, that window of time. Um, so neither going back to my story real quick, I started getting articles and and videos here and there about fasting. So I said, okay, well, apparently I'm being summoned to to look into this. So I started reading, and it started to intrigue me. And I had read different forms of fasting, and I said, you know what, intermittent fasting sounds easy enough. Let's try it. Within a very short amount of time, we're talking about maybe a month, maybe less, I felt, now I'm someone who's at least I like to think I'm in tune with my body. Okay, I know my body's reactions to things very well, and within, again, that first month, I noticed huge changes, huge changes in my mood. Not ups and downs. I'm saying my mood was good. Great mood. Very I should say centered. I was able to focus on my task. In fact, I was able to perform much more tasks in a short amount of time, um, also because of the energy that um, I had stored. The energy that you get while fasting is is huge. You get this surge of energy, and that energy is not that, coffee energy. It's not the jitters. It's it's an energy from within. It's that oomph. It's that, I want to tackle the day. It's a great form of energy. Um, but I felt all that. I was in a better state of mind. I had clearer thoughts. I was able to focus. I had a lot of energy. I didn't need so much sleep, and that actually got me into learning more about sleep. And the main point I want to just plant the seed in: sleep is about quality, not quantity. You do not need 8 hours. You do not need 10 hours. You do not need 6 hours. As long as you get quality sleep, you can sleep 3 to 4 hour nights without any problem. I'll go on the record and say that. But again, all these amazing benefits. My skin cleared. Now I don't have much acne or anything, but I had clear skin. Um, my body just felt lighter. It felt good, and I was heavier set back then. So I was losing weight. So all in all, it was I felt great. So that got me hooked, I guess, and it opened a door for me to try various forms of fasting. So from intermittent fasting, I decided to do a 24-hour um, uh, water fast, just 24 hours, simple increments, simple changes. Again, felt great. Why not 72-hour water fast? So I did. And again, the 72-hour water fast gave me that same surge of energy, that same clarity and focus that I had attained within a month of doing intermittent fasting. So I attained that level in a shorter amount of time. So that's how I learned the difference between, or I started playing around with the differences between um, the different types of fasting. In December, as you know, we're 2021, December of 2019, I did a I did a 7-day water fast, just water for 7 days. I wanted to try it. I had read about it. People have done it. Why not? I'll jump on the bandwagon. And the first 3 days I had done before, so I kind of knew how to judge that. The fourth day, I wanted to eat my leg. Um, but it was just I was needing to eat something. But again, just push the water intake. Um, I felt like a fish, but I pushed the water intake and just pushed through it until the fifth day. Fifth day, I felt amazing. Again, absolutely no need to eat. No hunger. No, not even. I could smell food being cooked. I could my senses were skyrocketing. I could walk down the street and I could smell, the burger joint there and the Chinese food there and the Indian food there. Um, uh, my uh, my ability to hear, to listen to everything my hearing was so much crispier. My sight was crispier. Senses were just heightened. And then I pushed through the 7 days. And since I had already um, made the mental program that I was going to eat in 7 days, I decided to have dinner that night. um, but it was amazing. I felt great. I felt better than I have had than I was for years, right? So that led me to do different forms of fasting, right? We did the 72 hour, the 7 day. I decided, why not try the hardest one? Let's do a dry fast. I did a 24-hour uh, soft dry fast. Again, the amount of time it took for me to feel that yummy feeling in a 72-hour water fast, it took me 24 hours on a dry fast. Then why not, since I'm on a roll, why not a roll? Why not do the intense one and do a hard dry fast for a period of 24 hours? Did it again. Just I can't sell this stuff enough to you. It felt amazing. I felt incredible inside, outside. Uh, my everything from having so much energy that I wanted to actually work out. I wanted to almost go for a run. And if anyone knows me, they know I am the most yin person you may know, yin and yang. I am the most yin person you may know. Um, the less physical activity I can do for the benefits, I will do. And I'm definitely not a runner. But I was pumped. I had so much energy to give, and it's not that it's not that bad kind of energy that needs to explode. I hope I'm making myself clear. It's just this, you feel good, you want to move, you want to do things. My meditations were so much deeper than ever in my 37 years. So much deeper. I was able to go really within, feel my body, feel, how should I say, connect with the being that resides in the vehicle, however way you want to, whatever vocabulary you want to use for that. But that's what I was able to do. It allowed me to do a lot of self-reflection work, um, to the point where I was happy with my life as a whole. I was happy with my physical body, mental body, emotional body. Work just properly aligned itself. Um, uh, Family, just everything just allowed for correct alignment. It was great. So, long story short, I promise. Last one. All of these benefits led me to do a little bit more research on long-term fasting. And I read so many articles and watched God knows how many videos on people that have done a 21-day fast, 21 days of only drinking water. So I can officially report that in November of last year, I did a 21-day water fast. Um, I can't begin to tell you how amazing it feels, how good it feels. And to set a goal like that and get to the end of the tunnel, it's now I understand people that do triathlons. I will not do a triathlon, but now I now I understand getting to the finish line. It's the feeling. It's an amazing feeling. Um, a little bit of the 21-day fast. Again, the first 4 or 5 days, I was a little, ready to gnaw on a piece of wood. But after day 5, day 6, smooth sailing. Absolute no uh, hunger for food. Again, it's a mental state of mind, right? You set your intention, and you're able to be like, oh no, you're eating a steak in front of me. We could have a meeting. Doesn't bother me, right? You just I was not hungry. In fact, so much so that in less because I started November 1st and I ended the 21st. But that the week of the 21st was Thanksgiving. And sorry, my mind cracked. I wasn't gonna go Thanksgiving with seeing everyone eat and not me. So, but I could have gone much longer without eating. Now, again, a, a, for someone who wants to do a 21-day fast, one, do the research and make sure you are in tune with your body. Make sure you know the subtle differences. Make sure you know signs of discomfort versus signs of pain. Make sure you know what your body is telling you. Because if you need nourishment, even if you're doing the 21-day fast, you can still get nourishment by by taking a protein shake or whatever the case may be, handful of nuts. Again, nutrient rich drinks or food. So that's something to be very mindful of. But I'm I was so excited uh, after the 21-day water fast that I now I'm planning on another 21-day water fast, maybe in April, maybe in May. I haven't decided yet. But for me, for my being, for me, I feel comfortable allowing myself to do two 21-day water fasts a year. I think that number feels comfortable to me. So that's that's my story. um, Again, I'm not gonna continue raving about it. It when you allow your system adequate time to rest, the benefits are feelable. You know the benefits because you feel them, you experience them. Okay. So now let's go into some of the what the science is saying with regards to the benefits of fasting. Excuse me, real quick. A little bit of hydration.
Dr. JR, there's also a couple questions on the Zoom if you want
Thank
to check those out too before you go on.
Sorry, I'm trying. I sometimes forget to check these. So, Jeremy, how long you used the intermittent fasting in order to feel significant results? I did intermittent fasting for maybe about a month and a half, but I started feeling the subtle differences maybe within, I want to say 3 weeks. Within 3 weeks, but again, it, it depends how in tune you are with your being. Um, it, it depends how you feel essentially. If you know how you feel, you can feel the subtle differences very soon, very short amount of time. Beverly, to get the best benefits of intermittent or any fasting, how many days during the month should you do it? Intermittent fasting is the easier form of fasting, and you could do that ongoing without a problem. And I don't know if you heard this earlier, but the appropriate amount to reap the benefits of intermittent fasting is 16 hours. So if you're able to do 16 hours, for example, stop eating at 8 p.m. and eat the next day at 12, you'll be golden. You could do that continuously. If you're doing the more severe type of fast, like water fast, the benefits that you will get, or at least that I got within a month of doing intermittent fasting, I got it within 3 days, 72 hours. And that's actually what they recommend. Everyone is capable of doing a 72-hour water fast without a problem. That's one more question. Jeremy, during prolonged fasting, can you keep working physically? How do you recover from fasting? Any special protocol? Okay, thank you for asking that. You can still work physically. What I recommend is not doing a cardio type of exercise, because you will feel a little bit more tired, but you can still do your daily responsibilities. Go to work. You could go on long walks. You can do muscle training. You are allowed to do muscle training during a fast without a problem. Also, another note to mention is that during a fast, you do not lose. Um, People think you're going to lose muscle mass. You do not lose muscle mass as much as you lose the rest. Okay, so just keep that in mind. But you can still work out. In fact, with my surge of energy during the 3 day, 7 day, and 21-day fast, I did high intensity interval training um, a couple times a week, if not every 2 days. And again, I felt amazing. So you can do it, just don't do long term cardio type. Like don't run a marathon equivalent. So no, did I answer all your questions? There was one more. Oh, recovering from fasting. Here, thank you. Recovering from fasting, it is of utmost importance that if you do anything that is more than an intermittent fast, so a 24-hour fast or more, you must break your fast with ease. With ease. So when you're ready to eat after a long-term fast of 24 hours or more, do not eat a steak. You will hurt your stomach. It's not going to feel good. The steak might taste delicious, but it's not going to feel good. Break it with a handful of nuts, or a smoothie, or a protein shake. In fact, what I recommend is breaking a fast at nighttime allowing yourself to have a full night's rest and having a nice breakfast the next day. Okay, a full breakfast the next day. So that's how I recommend that. So actually, God, time's fun when you're flying. 7:46 already. Let's go through the benefits real quick. So one of the main benefits, and people, I get this question a lot. People with diabetes. Okay, can they fast? Should they fast? Here's the answer to this. Several studies have found that fasting may improve blood sugar control, which is specific to people with type 2 diabetes. Okay. They've done studies where short-term intermittent fasting significantly decreases the blood sugar levels. Okay. Decreasing insulin resistance can increase your body's sensitivity to insulin. So what that allows is for correct transportation of, um, of glucose in your bloodstream. So that's why it's beneficial. Coupled with potential blood uh, coupled with potential blood sugar levels, fasting has been determined to keep your blood sugar levels steady, preventing spikes or spikes, or what's the other word, crashes of your blood sugar levels. So again, this is general information I'm giving, but just planting the seed so that you don't feel don't feel hindered. If you're diabetic, please do the research. Go online, look at medical journals to get more information of what type of fasting you can do or should do with regards to if you are diabetic. Okay. Inflammation. So we touched upon this earlier. Inflammation is, in my opinion, and in fact, many people in the holistic medicine community, in fact, the medical community as well, inflammation is the number one cause of disease. And disease, I sound like a broken record every time, but disease is two words. Dis-ease. It's when your body, and your body meaning your mind, body, everything is no longer in alignment, and it's not working at its peak. So it's no longer in a state of ease. That's the word disease comes from. And inflammation is the number one cause of disease. What is the number one cause of inflammation? stress. Okay. And there is external stress, there is internal stress, but there are many methods out there that you can use to keep your stress levels in balance. Now, there are good stresses. There are necessary stresses, um, and hopefully at a later episode we'll talk about the positive and negative stresses. But needless to say, stress in itself is not a good or bad thing. Stress is stress. Stress is stress. That's it. Point blank and simple. How we integrate or how we process or how we perceive that stress is what makes it a positive or negative thing to determining how we react to that stress factor. So acute inflammation is the body's natural um, immune process to help fight off infection, right? So that's normal. That's supposed to be there. Chronic inflammation is what has the negative connotation behind it. That's what gives us the state of disease. Um, and it's, I mean, the list of issues, actually, scientifically, it's been known to be involved in the development of chronic conditions such as heart disease, cancer, and rheumatoid arthritis. But I mean, the list is so much more extensive than that. Okay, but those are just some examples. Inflammation is being discussed nowadays as the #1% cause of disease. Some studies have found that fasting can decrease the levels of inflammation and help promote better health, better state of being. Just by switching your diet and lifestyle, and this is not uh, this is not easy for some. I'm not saying this is an easy path, not by any means, but by changing your diet and your lifestyle, you can significantly reduce the amount of stresses that cause you to be in a chronic state of inflammation. Okay, and there are many techniques out there. Number one, or the three pillars that I always talk about, or four, excuse me, that I always talk about is meditation, correct nutrition. So I don't use the word diet. I don't restrain myself from eating anything, but correct nutrition, proper hydration is of utmost importance, and movement. Those are the four pillars involved in the attainment of balance of stress, and therefore the reduction of inflammation. I'm going to push through these real quick. Wow, time flies. It has been shown so heart disease is one of the leading causes of death around the world. In fact, it's been estimated at a 31.5% of global or of deaths globally. And by incorporating fasting in your lifestyle, you can reduce your chances of heart disease substantially. Fasting has been proven to help brain function, brain structure. So now we are actually changing the structure of the brain, and cognitive function. Cognitive function has to do with our behavior and behavioral science. So that's huge. If you're able if fasting fasting essentially could protect brain health and increase generations of new nerve cells in order to enhance our cognitive abilities and functions. It has been proven to help metabolism. And as mentioned before, we metabolize not only our food and water, but our thoughts and emotions. And many times, people that find themselves overweight or in a state of obesity, many times it has to do with a hindering in the ability to metabolize thought and emotion. Ponder on that for a little bit. On your next meditation, I invite you to just let that sink in. Studies have found that it increases human growth hormones as well. So now we're talking about important protein hormones that play a role in growth, metabolism, weight loss, and muscle strength. And you're giving your body a time to rest. So for somebody that is that is overweight, it's natural that you're going to slim up. It's the nature of the beast. You restrain from eating, you're going to lose weight. Okay, but just be mindful that it's not only, dare I say, weight from fat. It's weight from everything that is weighing us down. Okay. Side note: fasting is the only the only people that I would not recommend fasting to are people that are severely thin or underweight. So that's just something to keep in mind. If they do a certain type of fast, they need to know how to nourish their body adequately during the period of time of fasting so that they don't lose more weight if they're underweight. So in a nutshell, I will leave you with this. If you want to try fasting and you don't know what type of fast to do, call Be Optimal. Make an appointment with any one of us. We can put you on a fasting regimen that is best adequate for you. Do the research online. Go online and see what resonates with you best. I will always recommend that during your fast, during the time you are fasting, and during the window you are allowing yourself to to nourish your body with food um, and water, always stay well hydrated. One, and fill your nourishment. Allow your nourishment to be full of nutrient dense foods. Okay, and to some people that might be a steak, to some people that might be organic foods, whatever the case may be, whatever resonates with you. There is no right or wrong way to fast. There is no right or wrong way to eat, as long as you find that balance that is adequate for you in this time. Because what is adequate for you now might not be adequate for you in a couple months, or might be completely different than a month back or 6 months back. Always look at your individual, your vehicle in the here and the now to determine what you do for the proper alignment of your consciousness, your mind, and your body. All right. Let me see if I missed any other questions here. Oh, I think we're golden. Look at that. 7:59 on the dot. All right. That is a very general introduction to fasting, the effects that I have personally experienced, and one thing I love about being the way I am is that I've experienced it. I've experienced the full range of fasting, and for my being, I absolutely loved it. um, the benefits outweigh anything else. So see what resonates with you best. And again, if you have any questions, give us a call, and we'd be glad to help you out on that end. But needless to say, last thing, and I'll leave it at that: give your body time for maintenance. Give your body time for correct maintenance in stillness within meditation, with giving it a break from constantly, you know, uh, uh, getting foreign food to be digested and metabolized. Give your body a break. If your body has a break, your mind will follow. And if both your mind and your body, if you give both your mind and body a break, you can literally reset your body at a cellular level. The impact on health that fasting can do has but just now is starting to flourish, and will continue to do so. I guarantee it. It's 8:01. Thank you, everybody, ladies and gentlemen. Have a great night. Again, thank you for joining Dinner with the Docs. We will see you all next month, fourth Tuesday of April. All right. Thank you, everybody. Good night.